Good afternoon. This is a special report from WBRN Radio in Boston, and let me just look at my little things here to make sure that I've got everything I need. Uh-oh. All right, here we go. And let me just check my time here. Okay. Anyway, this is a special report from WBRN Radio in Boston and on the Boston Red Network. The subject of our episode this afternoon is the American Health Care Act. It was just has been scored by the CBC. Let me just go to it very, very quickly here. And this was scored on and released today. It's a cost estimate here by the CBC, and the GTC estimates that enacting the American Health Care Act would reduce the federal budget by $119 billion over the coming decade, 10 years, and increase the number of people who are uninsured by 23 million in 2016. That's relative to current law. The staff of the Joint Committee on Taxation has completed an estimate of the direct spending and revenue effects of what is known as H.R. 1628. The Health Care Act of 2017 is passed by the House of Representatives. The estimate enacted the version there, and the amount is less than the estimated savings for H.R. 1628, which was posted on the website of the House Rules Committee. Now, this was on the 22nd of March 2017. And there have been various amendments to it. From the early amendments to legislation, anyway, we won't get into that. In comparison with estimates of previous versions of the Act under the House passed situation, the CBC and the Joint Committee estimate for the 2017-2026 period enacting would reduce spending by $111 billion, reduce revenues by by $992 billion, with a net reduction of $119 billion the deficit over that period. The provision dealing with health insurance coverage would reduce the deficit net by $783 billion. The non-coverage provision would increase the deficit by $664 million. This is it. And the pay-as-we-go procedure applied before enacting would have affected direct spending and revenue estimate enacted there on a 10-year deficit ending for consecutive years. The effects on health coverage: broadly defined, private health coverage as consisting of, this is what the CBC says, of comprehensive major medical policy that at a minimum covers the high costs of medical events and various services, including those provided by physicians and hospitals. The CBC and the Joint Committee estimates in 2018, 14 million more people would be uninsured under the Act than on the current law. In other words, this is under the Affordable Care Act, or Obamacare. The increase in the number of uninsured people relative to the number projected on the current law would reach 19 million in 2020, 23 million in 2026, and 26 an estimated try it again here, 51 million under the age of 65 would be uninsured, compared with 28 million who would lack insurance coverage that year under current law. So you can see the difference there under the legislation. A few million of those people would use tax credits to purchase policies. Under current law, premiums have been rising, and most stabilized enrollees purchasing health coverage in the non-group market are largely insulated from increased premiums because of out-of-the-pocket payments for premiums. This is very important here to come. Let me just go to the wider. This was posted now. The estimated cost here. This is on the 24th of. Let me make sure that we got the right thing. Of May here, and let me just go to. Oops. The CBC. Let me just make sure my estimates are right here. I was at the CBC's website here, and let me just kind of update this. Would leave 22 million. It's the basically the same. I just want to make sure we got everything right here. And that we don't have any overlapping here. I'm just looking at the New York Times here next. So we basically are looking at the same figures here. Now this is on the 24th. Now we're competing here. This is on the 26th. The Senate bill would increase the number of people by 22 million. Now, the American Medical Association has also come out against this particular provision. The newest rendition, let's say, of the Republicans' act. And we are looking here to see exactly where this act is going, if it's going anywhere. And the optimum figure here is 22 million. So we'll go with the 22 million that it will leave uninsured here. And we just need to take a look at one more thing here to make certain that we have the latest numbers out here, and evidently we do from the CBC. Now, this was on the May the 24th, but again, the CBC and its scoring mechanism here is basically the same. If we look at it, and this has been all day, this has been coming out here. The score was coming, and we wanted to make sure
the Senate would repeal the
that we have the latest information
which requires
here.
nearly all Americans to get coverage or pay a penalty. It's one of the most hated provisions in the
static
Affordable Care Act, and
now
Republicans have been trying to get rid of it for a long time.
An analysis of the Senate draft CBC says the number of people uninsured would be
provide subsidies
by comparison. Now, okay, let me just get all of this straight. Over the next decade, by comparison, CBC had early estimated that similar legislation passed by the House. This is where we get to 23 million analysis of the Senate draft. The CBC says the number of Americans who would be uninsured by the Senate bill would be 49 million. That compares with
however, the Senate
the estimated
for everyone as
51 million under the House bill.
Older people
now,
will end up paying a lot more for coverage under the Senate bill.
This is the CBC's here, and we're
like the House
trying
bill,
to get
the Senate
the latest
bill would
information
radically
out.
overhaul
This is from the
Medicaid
Reuters
huge, and a lot of people don't realize that. The Senate
here.
The bill would eliminate enhanced funding for Medicaid expansion by 2021. And
sometimes getting things
down
is
the
not
as received to cover low-income adults over 3 years. As
easy as one you would think here. Now, the forecast issued Monday by the Congressional Budget Office
that would force states to make up the difference, which they can't afford to do. That means
would reduce the federal spending by $331 million, and I'm not certain why we're getting this in here.
So what about people with pre-existing conditions? What is the Senate?
Right now, we are getting some background in here, but we'll try to go with what we have here. The analysis has
it would protect more people with pre-existing conditions
been away as a critical thing. This is from the Chicago Tribune here. The CBC has been regarded
not allow insurers to charge people more
as a source of neutral analysis.
But one thing
Keith Hall is a conservative economist who served in the G.W. Bush administration. It's a current director, Keith Hall, Dr. Keith Hall. He's been around for a very, very long time, and he served in G.W. Bush's administration. And for the Senate bill, the CBC estimates that insurance coverage and federal spending are influenced by factors. In its forecast, it covers 10 years. So we're seeing this. The bill, for instance, would leave the expansion. Now, a lot of this is information that we have, and we
this
don't.
This is the line that divides our community health. The state of Texas decided not to go with the Medicaid expansion, and the state of Arkansas did.
Now, some of this
even though they're right next door to each other.
Here,
now we're seeing vast differences in health.
Amlodipine. I have kidney disease. I have congestive heart failure. I have Crohn's disease.
And I'm not certain why we're having the
high blood pressure,
background noise
high
here, but I will
fibromyalgia,
get rid of it as quickly
vertigo,
as we
and probably some I'm missing, but right now that's what I can think of.
59-year-old Texas resident Hattie McElmore is a mother of two. And even though she worked for years filling other people's prescriptions as a pharmacy technician, she doesn't qualify for Medicaid under Texas eligibility requirements. But if she lived on the other side of Texarkana in Arkansas, she would.
You would benefit from seeing a nephrologist because you do have chronic kidney disease.
Now, what you heard in the background there was a combination of things. That was from the Kaiser organization. There, and as we look here to it,
I don't have insurance of any kind.
What do you say to your neighbors
who say we don't want to pay for your healthcare? And
it's not as though I've never worked a day in my life because
coming through.
I'd worked. So
the 22 million.
And you can't get
CBC,
it. No, you're sick and you can't get it. What is
estimate here?
Well, Hattie lives on the Texas side of the state line. Another woman a few miles away on the Arkansas side says she's having a completely different healthcare experience because she's on Medicaid.
Okay, this is actually coming from Money
after
here,
you got diagnosed with cancer
magazine,
did you start getting...
Showing you what happens from state to state. And this is one of the big problems that we have because it varies from state to state. And as we have this type of problem, you're going to have more and more of this type of problem coming up here, and what we're able to do about it is going to be daunting, because in other words, you're playing a troop of consequences with various states, and that in itself is really not the way that we want to go here. I was just looking to see if they have posted up the new information on their site. Now, here we go. This is the Better Healthcare Reconciliation Act of 2000. Now, this is what we want to have, and it just appeared here. Now, this is on June 26th, so we'll just get things right here. Let me just check and see. Okay, this is fine. We finally got it right. Anyway, this is the estimate here. Would reduce the federal deficit by $321 million over 10 years. It would have uninsured 22 million people. The Congressional Budget Office and the Joint Committee on Taxation have completed an estimate of direct spending revenue of the Better Healthcare Reconciliation Act of 2017. A Senate amendment in the nature of a substitute to, this is what we were talking about earlier in the broadcast, 1628, would reduce the cumulative federal deficit over 2017-2026 by $321 billion. The Senate's bill would increase the number of people who are uninsured by 22 million relative to the number under current law. By 2020, an estimated 49 million people would be uninsured compared with 28 million who lack insurance that year under current law. Now, the effects on the federal budget. Enacting this legislation would reduce direct spending by $122 billion, reduce revenues by $701 billion. That's $1 trillion there. Anyway, it's 320. The largest savings would come from reduction in outlays. Medicare spending on programs would decline in 2026 by 26% compared with the CBO's projection on the current law. And changes under the Affordable Care Act, Obamacare, subsidies for non-group health insurance. These would be partially offset by other changes to Obamacare. The largest increase in deficit would come from repealing or modifying the tax provision. You don't hear very much about that. Better not directly related to health coverage, including a repeal of a surtax on net investment income and repealing the annual fee imposed on health insurers. That would disappear. Pay-as-you-go procedures apply because enacting the legislation would affect direct spending and revenue. Estimated that enacting would not increase net spending on budget deficit for any of the 4 consecutive years, beginning in 2027. The agency expects the savings, particularly from Medicaid, would continue to grow, while the costs would be smaller because of rescinded taxes on employer health insurance premiums, and health care benefits would be reinstated in 2016. The effects on insurance coverage. In 2018, 15 million more people would be uninsured under the legislation than current law, which they mean Obamacare, primarily because the penalty for not having insurance would be eliminated. The increase in the number of uninsured people relative to the number projected on the current law would reach 19 million by 2020, 22 million by 2026. Medicaid would fall by about 16%. An estimated 49 million people would be uninsured, compared with 28 million who lack insurance that year under the current law. Stability of the healthcare market under current law, although premiums have been rising, most stable subsidized enrollees purchase healthcare coverage, and the non-group market are largely insulated. And this is pretty much what is went on there. Under this legislation, the CBC and the Joint Committee anticipates non-group insurance market will continue to be stable in most parts of the country. Is the key in the agency's view. The key factors include the following: subsidies to purchase insurance would maintain sufficient demand for insurance by people with low health care expectations. So in other words, if you have a Mickey Mouse policy, you would be okay. The effects on premiums out-of-pocket pay. The legislation would increase the average premium in a non-group market prior to 2020 lower average premiums thereafter relative to projections on the current law. In 2018-2019, on the current law and on the legislation, the benchmark has an actuarial value of 70%. That is, the insurance pays about 70% of costs, Medicare 80% of costs, and on the average market, such coverage is known as a silver plan. Under the Senate bill, the average premium for benchmark plan for single individuals would be about 20% higher next year than under current law. These premiums would be about 10% higher under current law in 2019 or less than 2018. In 2020, the average premium for benchmark plans for individuals would be about 30% lower under current law. The share of services covered by insurance would be smaller because the benchmark plan under the legislation would have an actuarial value of 58% beginning in 2020. The value is slightly below the actuarial value of 60% for bronze plans offered in the marketplace, because the ACLU limits out-of-pocket expense and prohibits annual and lifetime limits on payments for services. Now, to design a plan with the actuarial value of 60% or less, pay for those high-cost service, insurers must set higher deductibles. And now this is where the rubber will meet the road. Current law for a single policyholder in 2017, the average deductible for medical and drug is about $6,000 for the bronze plan and $3,600 for the silver plan, which is cheaper. Premiums for the plan, actuarial value of 58% or lower for the plan. So this is some of the things that start happening. Under the legislation starting in, that's what we mean, the better health care scheme that the Republicans have in the Senate. The premiums for the silver plan would typically be relatively a higher percentage of income for low-income people. The deductible for the plan actuarial value of 58%. By 2026, the benchmark plan for single individuals, most of the country on the legislation, we've got 20% lower than current law, a smaller decrease than in 2020. Uncertainty surrounds the estimate. Has endeavored to develop budgetary estimates that are in the middle of the distribution of current outcomes. Now, this is one thing to be remembered here, and this thing has been changing completely. We'll post this up, and if you want to, the PDF is also here, and it's coming up. I believe it's basically the same as the other part. We apologize for the technical difficulties we had. We were using a different workstation, and we were not plugged in to the router properly here, so now we are. So we are moving right along. Well, also, I just wanted to make sure the PDF version. This is the Better Care Reconciliation Act. I think it's basically the same here, more of the methodology. We'll place it up. It's 19. Wait a minute here. No, it's 49 pages actually is what it is. So you'll be hearing more and more about this. Let's quickly go to the other news around the Supreme Court today. The travel ban of DJ Trump is now in effect, and let me just give you the highlights of what is going on now. Effectively, what is happening here, if an immigrant has any type of relationship, a family, university, etc., they will be allowed in the country. Now, in the Washington Post, big 22 million more people uninsured by 2026. Not a good headline here. Let's go to the travel ban. It's a limited version here. Allow a limited version of DJ Trump's travel ban. The court's most important exception is the ban may not be enforced against foreign nationals who have a credible claim of a bona fide relationship with a person or an entity, in other words, if they are at a university, etc. It was unsigned opinion. The court said a foreign national who wants to visit or live with a family member who would have a relationship, so students are from designated countries who are admitted to U.S. universities. The court said it would hear the case in the fall. It may be a moot point. In other words, by the fall, the travel ban is on the 6 countries, 128-day ban on all refugees entering the U.S. with the exceptions. In other words, if you have family members, university, etc., you would be allowed in. Now, the Justices Thomas Alito and Gorsham would have left the travel ban take effect as written and objected to what they call the compromise. Well, it had to be a compromise, gentlemen. A partial stay will burden exactly. It's just crazy times. And in deciding the perils of contempt with an individual from the 6 affected nations who want to enter the U.S. have sufficient, well, they would have already entered the U.S. By now. As such compromise, the justice said, will lead to a flood of litigation over what constitutes a bona fide relationship. I think it's pretty much laid out here. If they have relatives, don't have relatives, admitted to a university, and that would also, in our opinion, including a job offer. Now that's just the 6th there. The challenges at the 9th, the 4th. There's a lot of circuit challenges here. Period. So basically, this is what you have on the travel ban. It is here, and the 120-day part of it only applies there. So in other words, another case, a religious case, involved a playground. A church in Missouri evidently wanted some money from a public fund. Missouri law had forbid that, but with this 7-2 ruling here, that it violated the constitutional protection, free exercise of religion, to exclude churches from a state program with a secular intent, in this case making the playground safe. So there you go. But the law in Missouri has this is Trinity Lutheran Church in Columbia, Missouri, wanted to participate in a state program but reimbursed the cost of rubberizing a playground. This is sort of an entry in. This is people want to rubberize things. Roberts was joined by Kagan and Beyer in the outcome of the case. So basically, let's see. It was a 7-2 ruling. You have a lot of those. The speculation around Justice Kennedy. What would Justice Kennedy do? Well, we don't know what Justice Kennedy would do or would not do. This is it. The Trinity Lutheran Church of Columbia, Inc. versus Comer, Director of the Missouri Department of Natural Resources. It was filed in the 8th Circuit. It sits in St. Louis. The Trinity Lutheran Church, and I'm just reading from the petition here, is a Missouri preschool and daycare center, originally established as a non-profit organization. The center later merged, with the Trinity Lutheran Church, and now operates under its auspices on church property. Among the facilities is a playground. In 2012, the center sought to replace a portion of the pea gravel with a porous in-place rubber surface. Well, so Missouri strapped tire program. I see what it is. Scrap tire program. So I guess that was a rubberized surface they're talking about there. The district court likened the case to Locke versus Davey, where the court upheld against a free exercise challenge a state decision not to fund a degree in devotional theology as a part of a scholarship program. the district court held the free exercise clause did not require the state to make funds available under the scrap tire program. Held the department's policy violated the rights of the Trinity Lutheran Church under the free exercise clause of the First Amendment by denying the church an otherwise available public benefit on account of its religious status. The court has repeatedly confirmed that denying a general available benefit solely on account of religious identity imposes a penalty on the free exercise of religion. That goes back to McDonald versus Patty, struck down a Tennessee statute disqualifying ministers from serving as delegates to the state constitutional convention a long time ago. So in other words, it's citing some more laws here, but basically that is where it is. A conservative organization brought it up, and the preference for skirting as far as possible from religious concerns in the face of a clear infringement on that. And that's signed by Roberts. We already talked about the people that signed it in the court. Ian Locke also stated that Washington's restrictions on the use of funds was in keeping with the state anti-establishment interest in not using taxpayers' money to pay for training of clergy. Now, the department's discretionary policy does not survive the most rigorous scrutiny that the court applied to the law, imposing a special disabilities on an account of religious status. Now, citing some cases here, the standard demands of the state's interest of the highest orders to justify the policy at issue in McDonald, yet the state offered nothing more than Missouri's preference for skirting as far as possible from the religious establishment clause. In fact, in the face of a clear infringement on freedom of speech. So that was how this was decided on freedom of speech. But what is actually going on here is sort of like using an ice pick to pluck away at a block of ice, and that is religion. So therefore, they are continuing on with it. These conservative outfits to mainstream religion into the public sector. The same thing with school vouchers for religious schools, parochial schools, etc. You're seeing more and more of that entrance into the secular sphere of society. So it is a political question, no doubt about it, and we'll continue to have these types of things going on. To recap, the 22 million people will go bye-bye. That's by 2026, 9 years from now. In the current version of what is known as the Better Healthcare Act, a felonious term at best. It's called the Better Care Reconciliation Act, and reconciliation is a tactic, or actually it is a rule in the Senate that allows the enactment of legislation with a majority of the votes there in the Senate, which would be 50 votes plus 1, and not the 60 vote majority that you would normally see. Now, the reduction of $321 billion, that's over 10 years, in the deficit would increase the number of 22 million. Now, these estimates are not etched in stone, but what they do is they compare it with what current law is, and the amendment in the nature of a substitute as posted on the Senate Committee's budget site on the 26th, that's today. So basically that is what we are working with now. But in overall question, it doesn't matter if they create 10 million uninsured people or 22 million uninsured people. Period. The problem is health care should be seen as a right. That is the reason that we advocate what is known as single payer. Everyone within the U.S., just like now, unemployment insurance, etc., would be taken out of your FICA, and that would eliminate that. Would be the end. You would have health care. Yes, you would pay more on your income tax return, but at the same time, you would get better health care, better results, and better buying power. And if for some reason the basket of benefits you received under the single payer didn't meet your quote-unquote needs, if you wanted more exotic care, you could then buy private coverage. But this is all about one thing, and one thing basically only, is tax cuts for the rich. That's the biggest part of this. And at the same time, loading it on the back of quote-unquote low-income people, the working poor in many of these states that have expanded Medicare. You heard a little bit here. This is what we are seeing, and we're seeing more and more of it. Do not be, as they say, placed under the illusion that this is just about, as Trump then would let you think, getting a better health care plan. It's not. This is not a better health care plan, period. Whether they want to call it better health care, it's not. It's worse health care. Now, in the Obamacare, yeah, there were a few things that could have been fixed, but they're not about fixing anything. They're about fixing the people of the United States. This is what this is all about, and has been about from day one. And if you look at some of the contributions to various of these senators that were in this mix, I don't know if I have it now or not. We had it up here on a Twitter feed of all things, and it may be gone out of here. We'll see if we can grab it up very, very quickly here. And of course, we are live. And we may not be able to find it. With the various senators and how much they were able literally to get here. But all of the senators, including Orrin Hatch, and various others, they all benefited from this. McConnell evidently got 400 and something thousand out of these various health concerns. So this is about what they were able to get, and as they say, to continue to ride on. This was basically done by old man McConnell's staff, general staff, and also at the same time he was a committee of some senators where you will see this. Now it is out in the quote-unquote light of day, and the light of day has shined upon it. We encourage people to contact their senators and the White House to address this great injustice upon the people, known as H.R. 1628, the Better Reconciliation Act of 2017. This is Boston Red on WBRN Radio, and we were live here. We'll update this and get it up as quickly as is humanly possible. Good day.